metatarsal bones are 5 long bones in the foot. They articulate proximally with the tarsal bones and distally with the phalanges. Fifth metatarsal, or the little toe, is one of the most commonly fractured bones in football. Fifth metatarsal fractures can occur due to low energy injury, including twisting of the forefoot and stress response trauma. There are 2 muscles attached on the fifth metatarsal via their respective tendons, the fibularis brevis and the fibularis tertius. The pulling of these tendons can actually pull the bone away. For immediate care, the patient may have a special boot fitted to ease the weight they are bearing on that foot. Crutches also help to allow the foot to heal. X-ray is the imaging modality of choice to confirm the diagnosis of the fracture. After surgery, the patient enters rehabilitation. With proper care, they can make a full recovery within a 3-month period. You can learn more about the human body with complete anatomy.